Yasmin, and I'm a dental hygiene student at Pacific University. I didn't just choose dental hygiene randomly. I chose it because I've seen what happens when people don't have access to care. And growing up in an underserved community, I understood early on that dental care isn't always a priority for families, not because they don't care, but because there are real barriers like cost, access, and availability. And that perspective has been ingrained with me, and it's really what pushed me towards this field. Now that I'm currently in clinic at school, I see those same realities every day. We treat patients from the communities who haven't had dental care in years, and what really stays with me is how grateful they are sometimes just for being seen, being listened to, and being treated with respect. And these are the moments that genuinely hit home for me, because it reminds me that dental care should never feel like a privilege, but it should be something that everyone has access to. And that's why I've been very intentional about staying involved in outreach outside of clinic. I volunteer twice a month on a pro bono dental van in my community, where I help take vitals and support patient care. A lot of these patients, are anxious or unsure, but even small things like how you greet them or how you make them feel can change their entire dental experience. And that's something that I truly value. I've also participated in events like Project Homeless and Give Kids a Smile, which have shown me just how many people are going without basic dental care, and those experiences pushed me to think beyond just becoming a clinician and a hygienist, but more about becoming someone who actively works to expand access and meet people where they are. And this May I'll be traveling to Jamaica for a sealant outreach program, where we'll be providing preventative care to children in underserved communities. And that opportunity means a lot to me because it aligns so closely with my purpose, which is focusing on prevention, education, and reaching communities that truly need it most. And looking ahead, I don't see myself just in one role or one setting. I see myself continuing to combine clinical work with community outreach, whether that's through mobile clinics, public health settings, or even volunteer programs. I want to continue showing up for patients who may feel overlooked, and make sure that they receive care that is not only effective, but also compassionate and respectful. At the end of the day, what drives me is knowing that access to care can change someone's health, their confidence, and even their willingness to come back. And if I can be a part of creating that kind of impact, even in such a small way, then I know that I'm exactly where I am meant to be. Thank you.